Hey guys, it's Jeanette. As you can tell by the title of this video, I am preparing for my head to toe assessment. So my teacher handed out a list of things that they will look for, and I've made it into a kind of a slideshow with some of my classmates just so we can prepare, make sure we don't miss anything, and make sure that we actually do the assessment at a good pace. The teachers have split the assessment up into two parts, so you'll see part 1 and part 2, and then I've spaced it where each section takes a total of 5 minutes. That is our requirement. We have to finish each section in 5 minutes. So overall, if you're doing the entire head to toe assessment, it's 10 minutes. So hopefully this is beneficial for you. I know I'll be using this to master my head to toe assessment. I want to make sure that I'm not missing anything and that I'm actually going at a good pace so I don't take forever. So yeah, also make sure to verify the information on each slide. I don't want you guys learning something incorrectly. So if you see anything wrong, feel free to call it out. I'll be more than happy to fix it and re-upload or whatever. So there you go. The rest of the video, you'll just hear me kind of just saying the titles of each section that you are assessing, and that's that. I haven't spaced it out where if you're just observing facial expression, that's going to take 5 seconds, and then maybe when you're doing I don't know, abdominal palpating, that may take 20 seconds. So I didn't do that. Each slide is about 10 seconds long, so you just kind of use it, just a guideline. Again, make modifications for you. So hopefully this is helpful. If you have any questions, feel free to leave it in the comments below, or you can tweet me at iFitNurse. And I think that's about it, so let's just get started.
Start. Part 1. Inspect and palpate cranium. Auscultate and palpate temporal artery. Auscultate and palpate frontal and maxillary sinuses. Assess TMJ. Assess external structures of eyes, ears, and nose. Assess visual acuity. Assess conjunctiva and sclera and perform the Pearl test. Assess cardinal fields. Assess facial sensations. Ask patient to puff out cheeks and smile. Assess hearing. Assess oral cavity, tonsils, and the rising of the uvula. Assess swallowing and protrusion of tongue. Neck. Inspect carotids. Auscultate and palpate carotids. Perform range of motion of neck. Palpate lymph nodes. Assess trachea is midline. Assess shoulder shrug. Assess skin turgor. Upper extremities. Assess skin temperature, color, hair distribution, and lesions. Assess arm strength. Assess hand grips. Assess radial pulse and capillary refills in all fingers. Assess functional reach. Assess skin sensation. Part 2. Chest. Inspect and palpate posterior chest. Percuss posterior chest. Auscultate for adventitious sounds. Assess spinal curvature. Assess CVA tenderness. Ask patient about flu and pneumonia shot. Assess skin turgor. Heart. Inspect for pulsations. Auscultate heart. Listen for murmurs and clicks. Listen for gallops. Abdomen. Inspect contour and pulsations. Auscultate bowel sounds. Auscultate arterial sounds. Percuss all four quadrants. Lightly palpate abdomen. Ask patient when they had their last bowel movement. Ask male about testicular self-exam. Ask female about breast self-exam. Lower extremities. Assess skin temperature, color, hair distribution, and lesions. Assess strength. Assess dorsalis pedis and posterior tibialis pulses. Assess edema in legs and ankles. Perform range of motion of ankle. Assess capillary refills in all toes. Assess skin sensation. Perform the Babinski reflex test. Ask about joint pain or tenderness. End.
Well, thanks so much for watching. Hopefully this is beneficial to you and that you are now able to practice and do a really good head-to-toe assessment. If you have any questions, again, feel free to leave it in the comments below. And don't forget to comment, like, and subscribe, and I'll talk to you guys later. Bye.